The product I will introduce today is the One485 KIT. The One485 KIT is the digital OneGuide version of the 485 KIT, which is dedicated for short implants in the posterior mandible. Its main indication is for placing short implants in cases with limited vertical bone height and in close proximity to the inferior alveolar nerve. In addition, because it is based on the OneGuide system, it allows for more precise implant procedures. When comparing it to the conventional analog 485 KIT procedure, as you can see, the residual bone is not always flat once the flap is opened. When drilling on uneven alveolar bone, the drilling path can deviate, and even with stoppers, depth control errors may occur because the stopper rests on an inclined bone surface. However, with the One485 KIT procedure, treatment is performed using a pre-planned and fabricated OneGuide template. This allows the stopper to rest on the flat guide surface, enabling much more stable depth control and ultimately allowing drilling at the exact planned position. Now let's take a look at this kit's benefits. The first benefit is that implants can be placed accurately according to the treatment plan. As mentioned earlier, conventional analog procedures may result in some deviation in the drilling path. However, with the One485 KIT, when a guide is fabricated based on digital planning, both drilling and implant placement can be performed safely and accurately at the planned position, even in close proximity to the nerve. The second benefit is safe procedures through prevention of inferior alveolar nerve damage. The rounded drill design helps minimize nerve injury. The drill tip is designed with a fully rounded shape and does not have a pointed Y dimension. In general, conventional surgical drills such as OneGuide drills or 122 taper drills include a Y dimension at the front, meaning that even if the drill specification is 6 mm, the actual length extends beyond 6 mm. However, 485 drills and One485 drills are manufactured with an exact 6 mm length. This allows for easier and more precise depth control during drilling and implant placement. In addition, the cutting edge is designed inward, which helps prevent damage to the inferior alveolar nerve. The third benefit is that OneGuide enables a more convenient prosthetic workflow. Since the implant can be placed accurately according to the plan, the abutment and provisional restoration fabricated together with the guide can also be delivered and connected accordingly. With the OneGuide procedure, once the guide is ordered, patient-specific prosthetics such as custom abutments or smart abutments are fabricated together and delivered at the same time. Provisional restorations designed to match these components can then be immediately loaded after surgery. As shown in the images below, OneGuide allows safe and accurate implant placement. You can also see examples of immediate loading using the smart abutment or custom abutment fabricated together with the guide, as well as same-day delivery of the provisional restoration that was provided together with the guide and abutment. The fourth benefit is reduced treatment time through a simplified drilling protocol. The implant can be placed immediately after only 3 drilling steps. The multi-step blade design provides excellent cutting performance even in hard bone. After twist drilling and initial drilling, only pilot drilling and final drilling are required, allowing implant placement after just 3 drilling steps in total. Overall, the surgical protocol is very intuitive and efficient. Next is the One485 KIT configuration. As shown, the upper right section includes the tissue punch and flattening drill. The drill lineup consists of 3 types: twist drilling, pilot drilling, and One485 drilling. On the left side are the regular specifications, while the right side contains the wide specifications. As shown below, the regular and wide versions can be distinguished by color: silver for regular and gold-coated for wide. In addition, the kit includes TS implant drivers such as the no-mount driver and implant driver, available in both regular and wide versions. The upper panel also includes 2 components, a torque wrench and a depth gauge. Lastly, the table below shows the compatible implant options. Overall, the 485 KIT supports implant placement from 4 mm to 8.5 mm in length, including 6 mm short implants. As shown, it is compatible with TS and KS3 Type 5.0 diameter short implants, as well as 7 mm and 8.5 mm implants. It is also compatible with SSII Type 5.0 diameter short implants, in addition to 7 mm and 8.5 mm implants. This concludes our introduction to the One485 KIT. Thank you.